A new report is shedding light on sickle cell care in California. An initiative in the 2019 state budget allotted money to fund a center specifically to address the growing need of care for patients with rare chronic inherited blood disorders. Now, 5 years after its creation, we're learning what's working and what still needs to be done. This morning, we welcome Dr. Diane Nugent. She's the founder and president of the Center for Inherited Blood Disorders. Dr. Nugent, good morning. Thanks for being here.
Randy, good morning to you and to the viewers. Thank you for having us on.
So this project was initially set for only 3 years, but now it's 5th year in of funding. What are some of the highlights of this year's report?
Well, thank you for asking. We've probably the most important highlight is that we've gone from zero access to knowledgeable care for clinics for adults with sickle cell to serving over 1,000 patients. And are with adults with sickle cell. We estimate that there's around 7,000 to 8,000 patients with sickle cell in our state. And we were experiencing back in 2018 a loss of life expectancy of 20 years compared to sickle cell patients in the rest of the United States, where the life expectancy is 61 years. That's already 20 years shorter than the average American. Mm-hmm. So something was going wrong in California, and fortunately, the state recognized that and gave us the funding to create these initially 5 clinics. Now we have 12.
Yeah.
And the job's not done, though. I think our report demonstrates that we have 12 incredible teams across the state. We're serving more and more patients. We have a huge number of young adults that are transitioning in. Half of the young adults that we expect are somewhere around another additional 500.
And Dr. Nugent, that's one of the things I wanted to ask you about, too. You've seen a growth in the number of patients, specifically at the UC Davis Clinic. The number of adult patients has gone down, though. Why do you think that is?
Well, again, it's a matter of access to care. And what we're still faced with are challenges with homelessness and insecurity. Access to care and knowledge base, even in our universities, is still a challenge. So what we are trying to do, and this is helping us, is to get the word out, to let people know that there are patients there. The job won't be done until we have sustainability in these clinics, and that's what we're working on now, fortunately, with the state, is to make sure that these clinics are able to maintain and meet the growing need for patients across California.
What do you see happening? We have about 30 seconds for the interview here. What do you see happening in the next year as far as the clinics are concerned?
The next year, we're transitioning to an enhanced care management model. And that will help us to meet the needs of housing, food insecurity, access to medical care. And if we can do that, we're no longer going to be dependent on our funding from the legislature, but the clinics will be sustainable in and of themselves. These patients need to stay healthy so they can get access to genetic and gene therapy, transformative care. If we don't take good care of our patients, they won't even be able to get access to that. And cure is available now. So we need to make that happen for these patients.
Dr. Nugent, we appreciate you joining us this morning. A lot of great information. Of course, we will continue to follow the work that you and your team are doing as well and update our viewers on the progress. Thank you.